Thank you for this, Dr. Henry. Regarding AstraZeneca, given that it's now going to be no more first doses, at least for now, is it likely or possible that the interval between the first and second dose will be shorter than the 4 months that currently ascribed to Pfizer and Moderna?
Yeah, so we're looking at all of that, and yes, we know that that it works better if you wait a little bit longer, but it's likely for all of the supply has come in, we'll be able to move up second doses for everybody. So if we think about our philosophy or the program that we have, the rationale for increasing the interval was twofold. One was because we know from other vaccines that a longer interval generally gives you better protection. But the other more important was that it was enabled us with the vaccine supply that we had to get more people protected with their first dose as soon as possible. And doing that protects to all of us because we are able to get to that community level of reducing transmission. But now that we have additional vaccine coming in place, we can move up the second dose particularly for those people who need it for their own personal protection. So dose 2 really is about increasing our own personal protection, so that bumping up from, in the case of Pfizer, from 80-some% to 90-some%. And that it means that we can make sure that those who are older, those who are clinically vulnerable for different reasons, are able to get their vaccine dose as soon as we have the supply for dose 2. So it is likely for everybody that we're going to be able to move up that dose 2. Having said that, there's some good studies that have shown that waiting that extra period of time actually gives you a better immune response, even in older people. So it is the two aims that we're trying to get to find that right balance. And yes, people with AstraZeneca, we will make sure that we are offering second doses to people in a time that makes sure we can use up all of the AstraZeneca that we have before the end of June. And there's some for logistical reasons where people need to have it on a slightly shorter schedule. But the minimum time period is 4 weeks.
You said a few minutes ago that many people will be coming due for their second dose in the next few weeks. I'm just wondering if you can give us any clarity on how many roughly, and is that calculated on that 12-week interval?
Yes, it is, and so it's calculated based on when people receive their vaccine first. So there's a lot of people right now. As you know, we started with healthcare workers and residents of long-term care, and we are now at the point where most of those people have received their second dose or are in the process. We had that period of time where we had very little vaccine come in at the end of February or end of January and into February, a very stressful period of time, as we recall. So there was a period there where we had a decreased number of people. So we're now getting past that period of time. If you think about that, March, April, May, we're now at the point where people are coming up again. So what we are doing is booking people at about 13 weeks so that we can be sure that they can get in and get their second dose before 16 weeks. And then we'll be looking at that. What we've done is take all of the logistics and operations as doses are coming in. We take the second dose requirements off the top. So it's in the 20 to 30,000 people over the next week, and then it goes up from there as more vaccine became available into March and April.